My name is Kmen Bhalang Khongwir. I work in the Directorate of Health Services under National Health Mission. I tested positive for COVID-19 on the 5th of October 2020. I personally had chosen to remain in home isolation, and I stayed since we have a separate room with attached toilet and bathroom, wherein it was totally separated from the other rooms of the other family members. So I stayed there under home isolation all by myself. After I was tested positive, 5 days after that, my family members all my family members with whom I've been in contact with were also sent for testing, in which the people from the health department had sent a vehicle to pick them up and took them for testing in the testing center. And after getting their samples taken, they were brought back home by the same vehicle. Eventually, and very fortunately, in the very next day, we got the report of all our family members, and fortunately, all of them tested negative. Even when I was working in the health department, in the Directorate of Health Services, I think one of the reasons was this habit which I've been following right from the time that we were involved with COVID-19 related interventions, is every day when I return home, I tend to take off my clothes and my shoes outside the house before entering the house, and hand washing and face washing and all that before I enter the house, and then I change my clothes accordingly. So when I chose to stay in home isolation, I always remain in the room, and the food and everything was being brought to me by my family members, wherein they brought their food in the table which were kept outside the room. We have a small passage in which we kept a table there, and the food was brought and kept there, and they informed me to take the food from that place. We always used disposable items, plates and cups and whatsoever, so that I don't have to exchange plates in getting the food every time. I try to be active by cleaning the room, even cleaning the tables where the food was kept outside on a daily basis. I try to mop the floor, mop the walls, do these kind of things, and of course I do actively involve with physical activities also, so that I become more active and more physically active, and then I can maintain my health also in that way. So even though I was home isolated, I was actively involved with my office work on a daily basis, wherein I had my laptop, my mobile phone. We coordinated with the various functionaries in doing certain things which were possible through online systems, online mode and all that. So these were the things, I try to be actively involved and try to do these on a daily basis. And that actually helped me in preventing any kind of, having any kind of negative thoughts or whatsoever. After my family members has tested negative, they still remain in isolation for another period of 10 days. And of course, I had to stay in isolation for a period of 17 days. And during this period of our isolation, the local Darbar Shnong, or the town committee, has been quite helpful in assisting the entire family in the house, in fact our entire family, in which they were in contact with us from in a regular basis, trying to ask about our health status and all from time to time. And also they also help in giving provisions for the house, wherein they give items wherein for our dietary needs and all that, since our family members could not go out for shopping and buying things. So the local community and Darbar Shnong had help in giving these things, and I think most probably it was assistance from the government side also. And of course, from the health department, I do get calls from health staff, wherein they try to inquire about my health status also from time to time. Well, my advice to all the viewers would be, we should not take this virus very lightly. We should try to maintain whatever protocols have been advised by the health department, in which we should always try to wear mask especially when we are outside, we're moving, when we're meeting people, maintaining that physical distance from one person to another, and of course hand hygiene. If we get a place where we can wash our hands regularly, we try to wash it. Otherwise, you can always use your hand sanitizers in emergency cases. So these protocols, if you follow strictly, I believe that it's the most important thing which we all should. And of course, we should not also you should not be afraid about this virus. If you have a positive mentality, a positive mindset, you can always overcome this virus, and eventually you will become healthy. And that is my advice to the viewers. Thank you.